Hi everyone, I'm Celia Grossman. I'm naturopath and clinical nutritionist at Naturopath Solutions. I use iridology in my clinic very often. It's a holistic approach to healthcare. It considers the relationship within the body and where imbalances are located and gives clues to what organs and tissues need nurturing. It does not attempt to address a specific symptom or disease. However, once uncovered, these imbalances and factors contributing to them can be addressed, often causing symptoms to diminish or disappear. It is also useful for preventative health because these imbalances in the body can be detected early on, giving rise for adjustments to be made using natural therapies. Iridology is an invaluable tool for designing a plan for well-being. For a long time, the eyes have been thought of as the window of the soul, but we're actually now seeing that they can also be the mirror of the body. Not only does the eye enable us to bring images of the outside world within it, but it also shows images of what is within to the outside. So, how did iridology as we know it today begin? Well, an 11-year-old Hungarian boy named Ignaz von Petscheli was playing in the garden with an owl. The owl became trapped in shrubbery, and as von Petscheli tried to free it, the owl suffered a broken leg. While nursing the bird back to health, von Petscheli noticed a dark marking appear in the owl's iris. He continued to observe this unusual marking over the course of time and noticed that it changed while healing. It eventually became pale and almost unnoticeable. Ignaz von Petscheli went on as an adult to become a successful physician. During the course of his time as a practitioner, he continued to observe the irides of most of his patients. He developed one of the first truly accurate Iridology Charts. Crude in design, it is still used as a model upon which all modern iris charts are based today. Around the same time, Reverend Niels Lindquist discovered the relationship between various drug settlements and specific discolorations in the iris of the eye. He first was aware of this from his own eyes after he received massive quantities of quinine as a young boy. Then there was Dr. Bernard Jensen, a chiropractor, who started looking at iridology in the 1950s. He's considered the father of the science of iridology in the United States, and his comprehensive charts, which were the fruit of 50 years of research and intense study, are still used extensively by iridologists today. A contemporary of Dr. Jensen, Dorothy Hall, recognised the unique connection between fibre patterns and colours in the iris and the personality of each individual. While there is still a lack of conclusive scientific evidence of the inherent value of iridology, what we do know is the iris is formed embryologically from the mesoderm and the neuroectoderm tissues. The mesoderm is those tissues that give rise to bone, muscles, heart, circulatory system, and sex organs. And the neuroectoderm tissues generate the various neurons and glia that comprise the central nervous system. Furthermore, the iris is connected to every organ and tissue of the body by way of the brain and nervous system. In this way, nature's provided us with a miniature video screen showing the most remote portions of the body and any specific tissue changes by way of nerve reflex responses. So here on this slide, we see two quite comprehensive iridology charts. The one on the right was devised by Dr. Bernard Jensen, and the one on the left is the one that I mostly use, devised by an Australian iridologist called Tony Miller. Here we are seeing the whole body at once, which is amazing. Each organ is identified, and those of major importance are outlined so that they are easily located. The chart represents the arrangement of the iris into its corresponding locations as found in a normally organized body, with the skin and the mucous membranes represented in the outer sector, the internal organs and the blood in the middle third, and the gut in the inner third. There's a lot of misinformation what iridology can actually reveal. And to set that straight, here is a list which gives an idea of what it has the possibility of revealing. Number one, inflammation, and this can be located anywhere in the body. What organs, glands, and tissues are in greatest need of nurturing and are at high risk of leading to disease? Constitutional strength or weakness, hyperactivity or hypoactivity of organs, glands, or tissues, such as sluggishness of the bowel, buildup of toxic material, prolapse of the transverse colon, lymphatic congestion, healing signs indicating an increase of strength in an organ, gland, or tissue, and the overall health potential of the body as a unified structure and the primary nutritional needs of the body. But what does iridology not reveal? Firstly, and most importantly, it doesn't diagnose conditions and diseases. It doesn't tell whether a person is male or female or whether the woman is pregnant. It doesn't identify the type of medication or drugs an individual is using or has used, or whether that person has had any surgery. It doesn't identify what foods a person eats or if that person has multiple organs or has a missing organ. It doesn't show the presence of gallstones and kidney stones or identify sexuality or AIDS. And it doesn't correlate tissue inflammation levels with a certain disease or symptoms of disease. The first thing that an iridologist looks at is the colour of the iris. There are three types: the blue iris, the true brown iris, which is actually quite rare, and the mixed iris, which is a mixture of the two and is much more common and often confused as a brown iris. People with the blue iris can potentially have lymphatic congestion, which involves excess mucus. Their health problems may include sinus troubles, ear, throat, and lung problems. Those with the true brown iris, they can have imbalances in blood composition, and they need to pay special attention to the circulatory system, the heart, the blood vessels, as well as organs that make the blood, the liver, the spleen, and the bone marrow, as well as digestive and endocrine systems. Those with a mixed iris, sometimes referred to as the biliary type, need to pay special attention to the digestive system, the stomach, the pancreas, the gallbladder, and especially the liver, as well as the intestinal tract. So the next thing that the iridologist looks at is whether the person has a strong or weak constitution. This is usually inherited from parents, grandparents, and great-grandparents. The strong constitution has tightly woven fibres compared to the weaker ones, which have got very loose fibres. If you compare the strong to the weak, it's like comparing silk to hessian. Now, when one has a weak constitution, it doesn't mean that they're sick, or they're going to have a shorter lifespan than the strong constitution, because the weak constitution recognise that they're tired a lot of the time, so they take extra naps. They're compliant with any advice from practitioner and with medication, and they just generally know how to take care of themselves and listen to their bodies. The strong constitution people are often working long hours, they're pushing through pain, they're in denial, they're not really in tune with what's going on in their body because they're almost ignoring it. So it's hard to tell which person in the long term will be the healthier. So the next major sign that an iridologist looks at is the ANW, the autonomic nerve wreath. This represents the autonomic nervous system, which comprises the sympathetic, which is the fight and flight nervous system, and the parasympathetic, which is the rest and digest nervous systems. It separates the gut area, or the pupillary zone closest to the pupil, from the ciliary zone, which is the area that represents the blood and internal organs. And what the iridologist looks at is the character of the A&W, that ring. Is it thick or is it obscure? Is it jagged or is it really very nicely round? How close is it to the nucleus, to the pupil? How far is it? And from this, they can gather a lot of information. So on this slide, we see a few of the signs in the iris that an iridologist will look for to see whether there is any dysfunction in the body, or to see whether a certain organ or tissues need extra nurturing. These have been inherited very often from parents, grandparents and great-grandparents, and can be seen in a newborn baby. They can show lack of structural tone in the connective tissue of a particular organ, or they can show lymphatic congestion. Perhaps there are problems with elimination of toxins through the skin, and a person can have skin issues when they have this sign, or they can have nervous system stress, or perhaps they're reabsorbing the toxins back into the system instead of eliminating them properly. Perhaps they have impaired circulation and might even have cognitive problems, or perhaps they have a defect in the elimination of toxic chemicals. So we get a lot of information from these signs. So the goal of every iridologist is to actually see improvements in the iris. Unfortunately, for most of the reflex signs, you're not going to see any change over the person's lifetime, but might be able to see an absence of them in the next generation. What you can possibly see is the pigments becoming lighter, and this is what you can see in these eyes in the before and after pictures. Since the main goal of iridology is not treatment, but rather prevention, there's also no inherent harm in the use of iridology. I mostly do not use this assessment alone, but use it in conjunction with a full medical history, blood and functional tests, and physical assessments. While there is still insufficient evidence to disprove iridology, it remains an invaluable tool for obtaining information on a person's overall health potential. And I find it quite accurate. And if you come to my clinic and have an iridology assessment, you might find it pretty accurate too. So I hope you do come, and I hope you try it out. And I hope you enjoyed this little video, and you'll join me again next time. Thank you.